Yo, what up? It's a tip of the week, and this is part 3 of the basic drugs you need for your drug kit. All right, I'm gonna repeat it again. Make sure your drugs are working, which means they're not expired. Make sure you know where they are, and then 3, how to use them. All right. The first drug we're going to talk about today is going to be atropine. Atropine is generally going to be used for patients who have a slow heart rate, aka bradycardia. That medication is going to be placed IV, and you're generally going to not want to use or exceed 3 milligrams. Make sure you go over the manufacturer's recommended uses for the drugs that I'm going to be giving you. Number 2, diphenhydramine, or big name drug called Benadryl. Depending on where you are, here in the States we use Benadryl, aka diphenhydramine. But the route that you want to use Benadryl, you can take it orally, intramuscularly, or IV. Now, be careful with Benadryl because Benadryl, well, I would say more so on the sedation side, could be a little, patients tend to get a little crazy on me. But diphenhydramine or Benadryl is for histamine release situation. So if somebody's having some type of allergic reaction, go ahead and give them Benadryl, and that will generally calm them down and also get them to go to sleep. It generally comes in vials that you could pull it up, dosaging up from 25 to 50. So just keep that in mind. There really isn't a maximum dosage that I found. So just once again, go over the manufacturer's recommendations to ensure that you're providing your patients with the best care possible. The last but not least is nitroglycerin. Make sure you know how to use nitroglycerin. Now, if a patient that you're working with is on Viagra or anything like that, you may want to watch that because you could potentially put your patient in some big trouble. So keep that in mind. Nitroglycerin is generally going to be used for patients who are having a cardiovascular assault or a some type of heart attack, for that matter, myocardial infarct. And what that does is it allows the blood to get back to the heart so that you could have reperfusion there. So keep that in mind. The drug comes in pills. It comes in a spray. If you're going to be using the pills, you definitely want to make sure that you don't give more than 3 because that's the maximum there. The dosage in which the pills come in is generally going to be a 0.4 milligram tablet that a patient goes and puts underneath their tongue. So there you have it. Those are the 3 drugs that we're using for the basic drug kits. We'll be rounding this session off soon, but just stick with me because my focus is for you to smile after surgery. Make it a great one.